Hello and welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwartz, licensed midwife and one of the MCs here at Gold. And here at Gold, we're getting ready for our Gold Neonatal Online Conference of 2023. It's just around the corner. Here at the end of May, we get started on May 30th for our big opening keynote presentation that is completely open access and available to everyone. But with me here today is one of our speakers of the conference. It's Dr. Kumar Ankur. Welcome. How are you?
Good. Hi, Christian. This is Dr. Ankur. Welcome, Auntie. It's a pleasure of mine to be here again in the Gold Learning.
It's wonderful to have you here again, Dr. Ankur. It's so good to hear from healthcare providers from all around the globe in our conferences and presentations. It's a world of learning here at Gold. I really, really love this. So before we talk about the conference and your presentation, first of all, Dr. Ankur, where in the world are you?
So I'm from Delhi, New Delhi. So New Delhi is a state in India. So I'm working as I'm a neonatal consultant at one of the biggest corporate hospital in the Delhi. So this is a BLK Max super specialty hospital. So I'm heading the department of neonatology, which is around 15 bedded neonatology hospitals. And so I'm also running neonatology fellowship program and as well as in the nursing fellowship program. So every year we train almost 4 to 5 students from my institute.
Wonderful. Thank you so much for sharing that. Yes, you are very busy indeed, working in this beautiful field of neonatology in that big hospital there, and also teaching, the next generations of nurses and neonatologists. That is so, so important there. And for how long have you been doing this now, Dr. Ankur?
So it's almost 17 years now.
Wow, a long
So
time.
yeah, it's a long time, and I love teaching, and teaching is my passion. So I think being a knowledgeable person is not everything unless until you impart knowledge and you give knowledge to others that ultimately improve the outcome of neonates.
That's beautifully said there. Yes, sharing that knowledge. And I can imagine in your 17 years and thinking also back when you were a student, so much has changed in the field of neonatology, right? I mean, it's unbelievable in just a few short years. Tell us a little bit about what you've seen, what really surprised you, and what you didn't think would have happened when you were like a student, what you see nowadays.
Yeah, that's a great question, Christine. I think when I was a young neonatologist, I wanted to do more lot of interventions. Intervention means sometimes being at intubations to the baby, lot of central line insertions. But over the years, we found that it is not the hi-fi technology, it is not the artificial intelligence, it is the basic neonatology which would ultimately help to decrease the neonatal mortality and as well as morbidities. Morbidities are too much if you don't, if you're giving a lot of injury to the newborns. So over the year, I am more conservative. I am less intervention specialist, more of clinicians and more of basic neonatology, which would ultimately help the neonatal outcome.
What a wonderful answer. This is really, really interesting because, as you said, so much has changed, so many interventions. And in the beginning of your career, you were all into, more interventions, and now stepping back, looking back, seeing the big picture and seeing like what is really necessary and what is right for this little, neonate and also their families, right? I mean, this is... we're looking at that too as well nowadays, that that is so important. And now we get to my favorite topic here. You are speaking about my favorite topic, as a matter of fact, the golden hour. And your topic is titled The Golden Hour of Neonatal Life, Improving Outcomes Through Evidence-Based Intervention. So tell me a little bit about this golden hour.
Kristen, why I choose this topic, because if you look at the total, deaths of newborn during the first 28 days of life, neonatology is first 28 days of life, almost 2.4 million deaths happen. And out of these 2.4 million deaths, almost 75% deaths happens during the first week of life. And out of this first week, this is the first hour of life, which is very, very important. If you improve the quality of care during the first hour of life, they can ultimately decrease the almost 20 to 30% of neonatal death, and which can be done everywhere, be it a low middle income country, be it a developed country. So it can be done everywhere. That's why we call it as a golden hour. And out of
Mm,
these all mortalities, the most common reason of mortality is prematurity across world, be it India, be it Scandinavian country, be it USA, America, and the European country. It is the prematurity. And
mhm,
second is the birth asphyxia, that is the intrapartum related abnormality. I think the golden hour includes these two components more, that is birth asphyxias and the prematurity. If you can prevent prematurity, if you can, I mean, give a good outcome to the premature baby, the outcome of death, not only the short-term outcome, even the long-term outcome would be better.
mhm. Oh, that's fantastic. A lot of great information you've given us just there in your answer. And you mentioned improving the care. It's so important of that first hour, the golden hour. But improvement of care doesn't necessarily mean more intervention, more
Yeah,
this,
yeah,
more
yeah.
that, right?
Yeah, WHO have seen that this is the basic care. Basic care means before delivery, if you give a mother to antenatal steroids, this is a very just a in a, just a I mean less than $1 of costs of
Mhm.
antenatal steroids. While at the time of delivery, don't give too much of oxygen. So oxygen would lead to lot of death. So
Mm,
titrate oxygen right in the delivery room. This is not costly affair. If you prevent the hypothermia being a skin to skin contact and doing
mm,
plastic wrap is again a very least costly interventions. And there are certain respiratory therapy like a CPAP therapy, which is easily available nowadays everywhere, be it a level 1 nursery or level 2 nursery. If you give CPAP and prevent hypothermia, start breast milk as soon as
mhm.
possible, you can decrease lot of morbidities and lot of mortalities. That is a
Ah,
very basic neonatal things, and these are cost effective interventions, I would say.
cost effective, and no matter where you are in the world, it's doable, cost effective. And going back also to skin and human milk, I mean, that all works so well together, and it's just so beautiful for me to see how much that really affects also the first hour, the golden hour there, and that we have so many tools at our disposal that don't have to cost much and don't need big machines. Yes, we have those too for, but that great care can be given so early on, and in this kind of frame. I absolutely love it, right?
Yeah, that's the thing we are going to discuss about the golden hour. It is not the very hi-fi things or artificial intelligence. It is going to be a cost-effective intervention solely.
Yes, absolutely. That's beautiful. Anything else, Dr. Ankur Kumar? What do you want to tell to our viewers here when it comes to that topic or improving care in general for these neonates?
I think we have already discussed about the many cost-effective intervention, but it is the communications which is very important. Whenever you have
Mm,
been called for a delivery, please discuss with your gynecologist, obstetricians, and then counsel the parents. And
mhm.
after once the baby is going into the NICU, again counsel the parent, give a positive feedback. Always counsel the parent. Be keep in the loop to everyone, be it the doctor, nurses, labor room staffs, be it the obstetricians, and the family. This is very important because if the family is, I mean, attached with you, they can give a family centered care. That is a one of the
Yes.
component of treatment. But you can, I mean, the mother can be a part of neonatal care, be it a day to KMC, skin to skin contact. I mean, sometimes even feeding preparations can be given through orogastric tube, maybe in the mouth preparations. And sometimes the small things like the cleaning the baby, sometimes changing of the diaper, be it there, spend more and more time with the baby. So unless and until if your communications is good, that is not going to happen. So
Mm.
all you have to involve family. It's a part of family centered care.
Family-centered care, absolutely love it. Good communication is so important. Keep the family, involved, and communicate everything that's going on. Have input, and make them take care of the care plan. Right, they are part of this. They are the
Yeah,
parents.
yeah,
So,
the parents.
wonderful. Well, Dr. Kumar, it's wonderful to have you here today. Thank you so much for your time talking to me about this presentation. We can't wait for your presentation at the conference. Thank you so much.
Thank you, Christian. Thank you, Gold Learning, for inviting me for this.
And now some information for our viewers. Of course, this presentation is part of our Gold Neonatal Online Conference of 2023. As I mentioned, we get started with our opening keynote on May 30th. All presentations are live, but they're always also recorded. So if you cannot attend a live presentation, the recording will be waiting for you. And so you can watch it at a time that's more convenient. And we would like to invite you to go to goldneonatal.com to find out when all the presentations are in your time zone, and more information about the presentations and the entire conference as well. Thank you, everyone, for watching here today, and have a lovely rest of your day wherever you are in the world. Bye-bye, everyone.
Bye-bye. Thank you.